When we got something to say, we go to where the cats play. Come hang with us for a while. We promise to make you smile. Cat Room Chats, starting right meow.
Hi, I'm Dr. Matthew Wheaton. I'm the owner of Alicia Pet Care Center, and I am here today to introduce our new veterinarian, Dr. Camille Coffey. She is actively here, and we are so excited to have her as part of our team now. And we just wanted to kind of get to know her with you guys watching what we're doing. So today we're going to have a little tea with coffee. Okay, so why don't we start with just your favorite part of veterinary medicine?
My favorite part of vet med is the variety of it all. It's not the same thing every day. I get to see all kinds of dogs, cats, little critters, everything from dermatology to radiology to surgery and everything in between. There's never a dull moment, whether it's a routine wellness exam or an emergency. It's always super fun.
It keeps you on your toes. Like
Absolutely.
Every single day you're learning something new and new challenges.
Yep.
That is one of the best things about vet med, is like you never know what you're going to get.
Absolutely.
Every day is going to be different. So very cool part of our job. How about the main goals associated with your career?
I have a lot of goals associated with my career. I want to be just really good at everything I do. I do have some special interest in pain management. As far as like acupuncture, I think a long-term goal is to do canine and feline rehab and get my certification in that, so I can take, ACL tear, CCL tear surgery and really expedite the healing process, as well as try to avoid that early onset arthritis as the dog gets older. Or just keep our kind of senior pets from having a lot of pain as they get older, and keeping their quality of life as high as I can.
Right, and you are very dedicated to that part of your practice. You're already acupuncture trained, and actively sticking needles in pets on the first day of your job here, which I love to see. That commitment to just making sure that pets are not suffering without some kind of effort to help them is just, it's the core of our job. It's like the core of what we're here for. So with all that said, you started your veterinary career basically in vet school, and your early part of vet school was a fairly unique experience for you. Could you talk a little bit about that? Because I know you got exposed to, that part of things, of just working dogs and injuries and all that kind of stuff.
Yeah, so I went to Colorado State University, and there they have a program where they work with the University of Alaska Fairbanks. They send 10 students up there. It's really cool because the ratio to student-to-doctor ratio is 2 to 1. So you really get a lot of hands-on, one-on-one education there. We got to work on all kinds of stuff, a lot of working dogs. So Iditarod dogs, Yukon Quest dogs. I actually learned how to do physical exams on sled dogs. So it was something we were seeing all the time. I also got to do cool things like work with muskox and reindeer, and do their wellness checks and work with the veterinarian who was on that. It's called LARS, the research facility that's there that has these Alaskan wildlife species. So it was this really cool experience where we got to do a lot in the first 2 years of school. And then after your 2 years are over, you go back down to Colorado State, do all your clinical years and graduate with your class. While you're up in Alaska, the classes are they're either hybrid, where you're in person and you're doing online lectures with your classmates in CSU, or all the way in person up in Alaska, or completely online. So there's a mixed bag. But it was super fun, a lot of hands-on stuff, a lot of early learning. And then you got to hang out with a whole other group of students through the last 2 years when you're in the hospital at CSU.
How cool. What a great experience.
Yeah.
Makes me think of the proximity of Alaska to the North Pole. You're pretty close up there. So I just have to ask, did you work on any celebrity reindeer?
Not any celebrity reindeer. However, Fairbanks is north of North Pole, Alaska. So my now husband used to live in North Pole, Alaska. So I spent a lot of time there. There is a Santa's workshop there. It's a kind of a remote campus. They have a giant, like, I don't know, 100, 200 foot statue of Santa Claus. They do have some reindeer in training over there, a bunch of toys and candy. So if you're ever in Alaska, it's a cool place to go. So I did kind of work with that remote team of Santas, but not actually with Santa.
Okay. He's kind of elusive.
Yeah, he is.
And busy, very busy.
Yes, very. A lot to do.
Let's go back a little further and like kind of what led you to small animal veterinary medicine?
Yeah, so if you asked me as a kid what I wanted to do, I always wanted to be a vet. I wanted to work with animals. I only read books with animals in it. I watched animal shows. I probably drive my parents crazy because that's all I wanted to do. At some point as I became, a teenager, I think a lot of my role models were human doctors. So I was on the pre-med track for high school and most of college until I got an internship in a human hospital and realized it was not a good fit for me. I just didn't enjoy my time there. Nothing against where I was. It just wasn't for me. Halfway through my junior year of college, not really knowing where to go from there, I got an email about a small animal veterinary technician internship. And it just made my heart happy. And I was like, I'm going to do it. And my advisor was like, that's not what you're on. I'm like, I don't care. Like, this is what I want to do. And on kind of a whim, but also based on what I wanted to do as a kid, I decided I was going to go pre-vet. And so I got my internship, I got all my hours, my GPA went up, like I was all of a sudden all motivated to go into veterinary medicine, and that alone told me that I was in the right field.
Yeah.
So that's kind of what led me, and then into vet med, and then I was a technician for a while, and then I got into vet school, and now I'm here.
What a great story. It's really inspiring to hear that part of things too, of like just realizing that you were tracking in the wrong direction for what you wanted, who you were, and going back to your, kind of core needs. A really, really interesting and inspiring story for a lot of people that, are looking at this and wondering, should I become a vet? And is that the right track for me? So I think, soul searching and really trying to make sure that you're choosing something for your life path that you're, going to resonate with you, and also something that is going to fill your cup.
Yeah, try stuff out. And if it's not a good fit, that's okay. It's okay to pivot.
Yeah.
So.
Yep. All right. So just, you've been practicing veterinary medicine now for a couple years, and I'm sure that you've had some standout cases. Can you think of a case that's like one of your favorite stories?
Yeah, and I was thinking about this question, and I have had a lot of cool cases, but my favorite case is one of my favorite patients and clients. The dog's name is Gus. He is this overweight, really, really cute, sweet Shih Tzu who's dealt with allergies his entire life, which can be really frustrating. There's a lot of trial and error, and a lot of people deal with it. And we ended up, because of the severity, ended up going on immunotherapy, and it has completely changed this dog's life. We can put him on a prescription weight loss foods. Now are the weight's going down. Like, I know it's a simple case, and the owner is just so nice, which is like so great and makes my heart happy. That is probably one of my favorite cases. I know it's ordinary, but it's like, it just really does make my heart happy because the dog improved so much. The people are so kind. I just love that dog so much.
Yeah. That's really awesome. I would agree with you on sort of the odd feels of this allergy case is an amazing case for me, let's say, because I feel like I broke through to that client and really made this long-lasting change for this pet. And some of these allergy cases are extremely challenging, so that I definitely get. That's cool. So can you give maybe a suggestion for pet owners that are your, things that you think every pet owner needs to know to just help them with their relationship with their pet and how to navigate some of those challenges? Kind of going back to my passion for pain management is that your dog is not moving slow because he's old.
there's a reason for that, and we can help. Whether it be, trying bringing his weight down, or doing acupuncture, or, screening for arthritis and doing all these things, like that's not a normal process. And there's so much and so many different ways that we can help that old, slower moving dog feel better and start moving faster and still being able to go on walks and do the things they like to do.
Well, age is not a disease.
Age is not a disease.
Right,
that's
so that's
so
kind of
true.
the thing that we say.
Don't be scared to do dentals in old dogs.
Yeah.
As long as there's proper workup and we have those full conversations about it. Like older dogs can really benefit from a dental cleaning.
Can you reflect a little bit? I mean, it's kind of interesting being a veterinarian because there's just not that many of us. We're sort of unicorns, okay, I would say a little bit. But, when you go to a gathering, it's not like you're going to see another veterinarian there. You're going to be the only one, typically. So that's kind of cool. I feel like it's a very neat thing because we're just unusual people and we have kind of an interesting job. But it is really our career and kind of what we identify with. And you're now embracing this, kind of putting on this coat now. What are some of the things that you hear from people when you tell them that you're a veterinarian?
I usually get really positive responses like, wow, that's so cool. I wanted to be a vet when I was a kid, but I either didn't want to do it or it was too hard, or I got into a science class and it was icky, stuff like that. I get a lot of, wow, it's harder to get into vet school than it is med school. I heard that on the grapevine. I'm like, yeah, it is kind of, but med school's hard too. So a lot of positive responses for the most part, which is really awesome. And then usually some follow-up questions about their own pet, which I'm happy to answer because I love them all.
It's always really fun to field the question about anal glands when you're at a cocktail party. It's the best.
Yes.
So, what you've been working for 2 years as a vet. You're doing some of these surgeries, and some of them you kind of have to do as an urgent thing. And sometimes those most urgent surgeries are a vomiting dog or cat that's obstructed. They have something in their intestinal tract or in their stomach. You've done some of these surgeries already in your young career. What's the weirdest thing so far that you've taken out of a pet?
Probably the weirdest thing I personally did was a tampon in a 12-year-old dog that's never eaten anything in his entire life that he wasn't supposed to. A lot of foxtails, and my own personal dog ate a corn cob and had to have that taken out.
Oh no, the corn cob.
The corn cob got her, so.
For me, I really hate corn cobs.
Yeah.
I do love corn.
It's true.
All right, so final question, and it's really, really an important one for our particular practice. But what do you think is the most common dog name?
Bella.
She nailed it. It really is just factual. It's just facts.
Yep.
Well, thank you so much for helping everybody get to know you today.
Of course.
It's really a pleasure to have you as part of our team, and I hope that all you guys get to come in and meet Dr. Coffey. She's an incredibly intelligent veterinarian, but has that burning desire inside of her to make a huge difference, oftentimes through pain relief and focusing on just the overall well-being of your pet. So I encourage you to come on in and make an appointment with Dr. Coffey, and thank you for your time.
Yeah, of course. Excited to be here.
Tea with Coffey.